it up a little bit. Thank you. Yes.
Tanya, are we ready to call the meeting to order?
We are ready on this end.
Okay, thank you. We welcome everyone to the audit committee meeting. I know we have Dr. Ruth on the line, and Norm Board is present there. Thank you, Norm, for being present. Not sure we have any other board members on the line. But we welcome everyone. We've got a fairly short agenda today. We'd like to start with just reviewing the minutes from our September 12th meeting. Those have been provided previously, and just ask if there's any corrections or updates anyone knows to the minutes that have been provided for September 12th. If they're not, then those minutes will stand as presented to us. We'll now ask Joe Hood if he had some opening remarks from the department.
Thank you, Mr. Chairman. Thank you all for being present today for our audit committee. The opening remarks I really wanted to present to you, other than just appreciation that you're serving and here this morning, is to please keep in mind that as Sonia and her team go through the audit committee report, that even though you may see several items that are partially resolved or in progress, that those many times as a corrective action take us years to implement. It doesn't mean that we're not compliant or we're not working towards the correct solution. It's just that staffing or infrastructure changes may not come as timely as our next yearly audit. So I just want to keep everything in perspective as we go through. I think we have great audit reports, and they've done a great job of summarizing that for you this morning. And if you have any questions, of course, Sonia and her team will be able to answer, and just appreciate you being here. Thank you, Mr. Chairman.
Thank you, Joe. Appreciate you being here today and being involved with us. So at this time, Sonia, we'll turn it over to you and David to present.
Thank you very much. So good morning, Chairman Cruz, Mr. Boyd, Chairman Folson, Audit Committee members, Commissioner Carlson, other DCH executives and colleagues. I am Sonia Smith, Inspector General for the Department of Community Health. It is always a pleasure for me to have an opportunity to meet with you quarterly and to give you an update on where we stand with our audits here at DCH. I'd also like to introduce David Chong. He is our Deputy Inspector General and also our Audit Director. So he may have some things to add as we move through this presentation. Kristen, would you go to the next slide, please? And Kristen Rayleigh is moving our slides for us. She is our Auditor 3. If you would move to the next slide and the next one. I'll start with slide number 4. This is our update for the Office of Audits. I would like to share with you that we currently have 4 active audits, 3 of which have been ongoing for a while, and they are all related to audits from the Centers for Medicaid and Medicare Services, CMS. So these are our CMS audits. The first audit is the COVID-19 Public Health Emergency Unwinding Medicaid Beneficiary Eligibility Review. CMS continues to review Georgia's Medicaid beneficiary eligibility and enrollment process to assess the accuracy of eligibility determinations for the Medicaid population during the COVID-19 public health emergency unwinding period. This audit started in January of 2024. This audit today is closed. There were a few disenrollment issues which CMS has confirmed that the state of Georgia has either reinstated those individuals or made corrective actions to resolve those issues. CMS did mention that this was an overall positive and incredible experience.
Sonia, can I ask a question?
Yes, sir.
If I understand it right, this is referring to the re-enrollment that had to take place in Medicaid after COVID? Is that what we're talking about?
Yes,
So that was a massive job,
yes.
but you're saying that it has been completed?
It has been completed and CMS is pleased with our efforts.
Okay. Okay, thank you.
Now, thank you for the question. The second audit that we have active is the Home and Community-Based Services Assessment. As a part of CMS's ongoing efforts to provide states with technical assistance regarding the home and community-based services setting regulations, CMS conducted on-site visits in Georgia. These visits were conducted in April of 2024 and was intended to assess the implementation of the settings criteria throughout the entire HCBS systems. DCH is meeting with CMS on a regular basis to discuss the status of approved milestones to ensure that DCH will be 100% compliant with complete implementation of the settings rule across all 4 waivers, namely the EDWP, which is the Elderly and Disabled Waiver Program, the ICWP, which is the Independence Care Waiver Program, NOW, which is the New Options Waiver Program, and COMP, which is the Comprehensive Supports Waiver Program. And we hope to have some resolution or this audit to be finalized by July 31st, 2025. The third audit is the Medicaid Managed Care Mental Health and Substance Abuse Use Disorder Parity Requirements. This CMS review evaluates both DCH's and DBHDD's efforts towards ensuring that mental health and substance abuse use activities are consistent across the managed care organizations. The fourth and last CMS audit that is active right now, and it is a new one. It is the Medicaid Managed Care Plan Program Integrity Audit. CMS will be conducting an audit of the program integrity activities of the Georgia Managed Care Plans. A few examples of what this audit will entail include the following. CMS will review the managed care plan's compliance efforts, such as utilization of cost avoidance measures, conducting investigations/audits. They're going to be reviewing to see if the managed care programs are taking the necessary steps to safeguard the Medicaid program. Another example is that they will be ensuring that the plans have the proper safeguards in place to prevent payments for issues such as services after a beneficiary's death and to deceased or excluded providers. They will also conduct claims reviews of areas known to be of high risk for fraud to make sure that claims are paid properly and that services are medically necessary and that services are indeed being delivered. And then a final example is that they will be reviewing denied claims to ensure that the plans are not inappropriately denying medically necessary services. Next slide, please. This slide represents those audits that are currently active with the State Department of Audits and Accounts, DOAA. We currently have 3 that are ongoing, and they include, first of all, the 2024 Annual Comprehensive Financial Report and the Single Audit. which includes a review of our prior year findings. Now, the period that's covered under the 2024 statewide single audit is July 1, 2023 through June 30th, 2024. That represents the fiscal year that just ended in June of this year. Annually, the State Department of Audits and Accounts, they audit the federal Medicaid program, as well as this year, they are auditing the Children's Health Insurance Program, CHIP. This report is required to comply with the federal provisions and is prepared in accordance with the uniform administrative requirements, the cost principles, and the audit requirements for federal awards. We expect that this audit will be completed by the spring of 2025. The second audit is the Medicaid dental program, which is a follow-up to the performance audit that was performed back in 2021. So that audit is still ongoing, or the follow-up is still ongoing. And then finally, as it relates to the State Department of Audits and Accounts, we have the Healthcare Facility Regulations Performance Audit. That audit started in February of 2024 with the focus of reviewing the efficiency and effectiveness of our state's effort to ensure safety and quality of care in Georgia's healthcare facilities. Next slide, please. Okay, this slide is intended to display the audit findings that are still, that we are still working on. We have five audit findings, and they are from our 2022 audit. I'd like to bring to your attention that we have 2 financial statement findings and 3 federal award findings. And I'd like to take a few minutes just to describe the difference. The difference, or the financial statement finding and the federal award finding are all related to the different audit standards. The financial statement findings are generally state findings and are related to our annual financial statement. The federal award finding is related to the federal program or the federal audit, the statewide single audit, which is related to compliance of the Medicaid program only. So now I'll take a few minutes and just walk down each finding. I'll remind you what each finding is about and just talk about where we are in resolving each finding. The first finding, 419-2201, belongs to the Division of Financial Management and is partially resolved. The finding is that DCH should strengthen internal controls over accounting and financial reporting processes and procedures to ensure the accuracy of the information it prepares for the state's financial statements and notes disclosures. Now, the financial management team has worked tirelessly over the past 2 years to resolve this finding. While post-closing adjustments have been necessary to ensure that financials are presented correctly, processes have been established to reduce the need for these corrections on the back end of the process. Resources have been provided to address bank reconciliation issues, which are still in progress. We had many reconciling items that needed to be researched and addressed from prior years. And then lastly, additional processes were implemented in finance to ensure that the financial information that is reviewed thoroughly. We anticipate having this finding resolved by the fall of 2025. The second and third findings. Yes, sir. Yes, sir.
How long has that findings been on the audit report? Every year for?
3 years.
Since 2022, so this will be 4th year. I'm sorry, 3rd year.
3rd year.
Yeah, 3rd year.
So fall of 2025, we will not have this on the,
That's our plan.
that's your plan.
Yes.
The department's plan.
That's the department's plan, and it is certainly contingent on whether or not the Department of Audits accepts our plan. But we feel confident that we're getting there.
Okay. nothing, nothing material in that finding.
No, nothing material. Processes.
It's improving our processes.
Yes.
Okay.
Yes, it's improving our current processes as well as making sure that we do things in the period and upfront instead of doing it at the back end. It's almost like letting things happen and then we fix it. So we've improved that process to make sure that we address those issues as we go.
Thank you.
More than welcome. The second and third findings are the same, and they belong to the Office of Information Technology. This is the example of where we have a financial statement award and a federal award finding. So the finding itself was presented both for the state and for the Medicaid program. And it is partially resolved. The finding is that the Office of Information Technology should continue to strengthen controls over its application risk management program. These findings, as I mentioned, appear twice, and we've had this finding for the last
2021?
2016.
Yeah.
Since 2016. This finding has required us to identify resources to assist IT in implementing a formal risk assessment program. Now, the formal risk assessment program is intended to review and assess and track the results of our business partners' risk while they work within our system. So it's making sure that our partners have good processes in place before they connect to what we're doing. We anticipate having this finding resolved by the summer of 2025. So we've made efforts over the last few years to address these. The Department of Audits and Accounts has accepted the majority of our corrective action plan. Just have a few things that we need to finalize in order to have this completely resolved.
Good morning. This is Kathleen. I have a question. Can you elaborate a little bit more around the risk management? What that actually, can you provide some definition or around that? Please, thank you.
So DCH has several service organizations along with many internally developed systems that processes claims and many information that are fed into or part of, will eventually end up being part of a financial reporting process. So DCH has done a great job of tackling more difficult portion of what's required. However, DCH needs to continue working on documenting the risk assessment. What are the risks associated with those service organizations, as well as some of the internal systems that DCH currently is using. And then we do need to document those risks and then address the risk. Document how we are addressing the risk related to the IT systems for the department.
Okay, so we're talking about information compliance. Is that my understanding? Is that a good?
Yes, ma'am. Mm-hmm.
Okay, great. Thank you so much.
And David, the area of possible data security and data leaks fall in this area of risk management?
Yes, sir. Yes, it does. And DCH has done a great job. Our cybersecurity officer, William Manahan, he's been upfront on the cybersecurity issue. And as a matter of fact, I believe he's been more proactive than what's required by the auditing standards. And we are currently in a process of getting certified. I believe it is called HIST. And we should be getting assessment sometime in the fall of 2024, if I remember the schedule right. So to answer your question, the cybersecurity is part of this overall risk management framework that DCH is currently developing.
And that risk really never goes away, does it?
No, it doesn't, unfortunately.
Never.
Yeah, they're just saying it's not, unfortunately, people say it's not a matter of
We hear
when.
about data leaks
Yeah.
in lots of places every day, it seems like.
Yes, sir.
So
Yeah.
if we haven't, if we're got the right processes in place to the best of our ability to guard against that is what we're trying to achieve. Is that right?
Yes, sir. And my understanding is that once we are in compliance with the highest level of security standard, then we are going to be requiring our vendors to meet the requirement as well too.
Yeah, that's a valid point. I think a lot of times when I've seen in the corporate world, these things happen, the data breaches really originate with suppliers and their connectivity to the, anyway. Thank you.
Thank you. Our next finding, which is 419-2202, belongs to the Medical Assistance Plans Division and is also partially resolved. The finding is to improve controls over managed care organizations' financial audits. At the time of this audit finding, DCH did not have adequate controls in place to ensure that the required managed care organizations' financial audits were being conducted in compliance with generally accepted accounting principles, and that those audit results were posted to the state's website. Processes have been established within MAP to ensure that MCO financial statements are reviewed annually and have been posted to our website. Now, MAP will be able to resolve this finding once the MCO RFP process has been complete. And that is because the requirements in the RFP, it is there there's a requirement in the RFP to present the financial statements based on the required basis. We currently have the MCOs presenting the financial statements on a basis that is not generally accepted accounting principles as required. So in light of the fact that we were in the procurement process, we decided to make sure that we added that requirement in the RFP and to allow for the RFP to finalize before we could address this and actually get those financial statements in that standard. So that will remain partially resolved until we're able to finalize.
Sonia, I just wanted to add a couple of things here, if I might.
Please.
So I just want to assure the committee that, and the public, that even though we do not have a gap standard audit for each of our care management organizations as stipulated in this finding, we do have the audit that is required by the Commissioner of Insurance. And each of our CMOs has met the requirement for the Commissioner of Insurance, which is really in many ways, a tougher standard for them to meet, because it demonstrates their cash flow and liquidity for the insurance industry so that they can be certified and assured that they have liquidity to pay claims. And it removes many of the gap standards, such as depreciation, from the financial statements in order to demonstrate that liquidity. So I just want to make sure that the committee understands there is no risk or even truly a finding in the respect of them reporting financials and them having appropriate audit opinions in regards to providing insurance and the backing of the claims that are necessary. It is truly just that they have not provided a gap standard financial statement, which is really a change in how you would present that in the insurance industry. And as Sonia's indicated, we would address that in new contracting. But in many ways, we meet this standard just with this other reporting basis that she referenced that is required by the insurance industry.
And Joe, could you just update everybody on the projection for the new contracting with terms of?
Sure, I'd be happy to, Mr. Chairman. Yes, sir. So for those who may not know, we have currently announced a notice of intent to award new CMO contracts that have just come out of a competitive procurement. A notice of intent to award is in place until such time as any appeal has been met by those who were not posted as the intended awardee. We expect that the appeals process may be lengthy and may go even up to 2 years. So the new contract would not come into place until we have it, one, approved by CMS in totality, but more importantly, until we resolve the appeals process. So that might be, 18 months out from now at the latest or so. Somewhere along those lines would be my prediction. It's really hard to say because of the appeals process and knowing what may come about and what may not, and how the Department of Administrative Services and the court process deals with those appeals. As y'all are all aware, I'm sure this is a multi-billion-dollar procurement. It will last over the next 7 years. So many of these companies have invested quite a bit of resource into applying for a new contract, and rightly so. Will make certain that they have their full appellate rights before we finally resolve and make the final awards, and that will dictate when we have new contracts.
Thank you.
Thank you,
Thank you,
Sonia.
Jay.
Yep.
Thank you, Jay. The last finding that I will mention is 419-2207. It is improved controls over the Medicaid capitation payment rates. This finding belongs to the Division of Financial Management's Office of Reimbursement Services, and it is partially resolved. DCH made capitation payments for Medicaid managed care recipients using an incorrect payment rate. The correction for this finding has been submitted to CMS for approval. Once approved, we will implement that change in GAMIS. May I answer any other questions for you?
And when is this one going to be resolved?
Yeah, I forgot to say that. It will be resolved once CMS approves approves our correction, and we don't have a time frame on
We
that.
have made the correction. We're just waiting for an approval of that correction.
Yes.
Okay.
Or maybe I should say, we will make the correction once CMS approves our plan. I think that's a
Oh, I
little
see.
different than what you just
All right.
said.
Okay.
So it hasn't been corrected, but it will be once we get approval from CMS to do so.
Okay.
Thank you. I wanted to make sure I clarified that. May I answer any other questions for you? If there are no more questions, I think that's the end of my presentation, Mr. Cruz.
Thank you, Sonia. At our next quarterly committee meeting, will we be addressing the DOAA findings for year end 6/30/24?
Our next quarterly meeting should be in March of 2025. And I think typically DOAA will be finished with their audit closer to April, May timeframe. So I don't think we'll have updates at that time from the 2024 audit. So I don't think it'll be ready by the time we come to our next quarterly meeting.
Okay. All right. All right. Is there anything else that needs to come before the committee today?
Should go back to the agenda.
If not, then I thank everyone for participating, and thank you very much for the update, Sonia and David. We really appreciate the follow-up efforts and the intensity to try to resolve these findings, and we appreciate you keeping us updated.
My pleasure. Thank
And-
you.
Yeah. And we stand adjourned. Thank you.
Thank you all.
Thank you.
Good, Sonia.
Sir.